Alrighty, for this week's discussion, let's make sure we post the right video. Just kidding. Alright, so in reference from Chapter 8, in order to treat a patient that suffers from recurrent herpes simplex lesions, I would recommend the topical antiviral agent called penciclovir. This topical is known to treat recurrent herpes simplex for a longer duration compared to other antiviral agents because it has a higher concentration and can stay longer within the cell. Penciclovir is also good for minimizing painful lesions of the lips and face. So due to the painful lesions around the lips and nostrils mentioned in this case, I would emphasize the importance of the antiviral topical drug and ensure the patient applies it correctly. However, since the patient has recurrent lesions, it is probably best to postpone any treatment until the lesions are scabbed or completely healed, because during the vesicle stages, herpes are the most contagious. On the other hand, antifungals are used to treat fungal infections. Apparently, fungal infections can be quite difficult to treat because they tend to naturally be resistant to certain drugs. As much as it is important that the patient is aware the importance of treating the fungal infection with antifungals, they also need to be aware of the adverse reactions caused by the drugs. For instance, nystatin may cause hypersensitivity, and most importantly should be aware that nystatin contains sugar, which can pose a risk for caries, especially if the patient is using the lozenges and having to use them 4 times a day. This can give them a high risk of caries. Next, the 2 natural herbal supplements I chose are St. John's wort and niacin. St. John's wort is a beautiful plant with neat-looking yellow flowers. This herb has been used as a supplement for centuries. Presently, it is the most commonly used to treat depression, ADHD, OCD, menopausal, or hormonal disorders. However, the supplement may have a negative interaction with many other drugs such as warfarin, digoxin, and which can induce the metabolism of many other different drugs. St. John's wort is also known for having an effect with local anesthetics and causing xerostomia. If a patient is taking the herbal supplement, it is best to provide fluoride therapy, xylitol supplements, and proper OHI. As for the second supplement I chose, which is niacin, it is a vitamin B, or a type of vitamin B. Niacin is good for reducing cardiovascular diseases or coronary artery diseases. It is also used as an adjunctive therapy for treating severe hyperglycemia with people who are at risk of pancreatitis. With niacin, alcohol consumption should be avoided to prevent hepatotoxicity because it can really do some damage to the liver. Other drugs that are a contraindication are antidiabetics and cholesterol medications such as rosuvastatin. Some adverse reactions may include tachycardia, hypotension, dizziness, rashes, GI pain, blurred vision, muscular cramps, and decreased platelet count. I would recommend raising the patient's chair up slowly after being in supine position for so long to avoid orthostatic hypotension. Then I would probably have them dangle their feet off the chair to get their blood circulating, and then have them stand up slowly. That is all. Thank you.